Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Ever wondered when and how to use ibuprofen? Ibuprofen is a non-steroidal anti-inflammatory drug, commonly known as an NSAID, that's widely used to relieve pain, reduce inflammation, and lower fever. Now you may be wondering, how exactly do you use ibuprofen? Taking ibuprofen is relatively straightforward, but there are a few key steps to follow. Always take ibuprofen with food or milk to ward off a stomach upset. It's paramount to adhere to the dosage instructions on the label or as directed by your healthcare provider. Remember, exceeding the recommended dose or taking it for an extended period without consulting a doctor can lead to complications. So, you've taken your ibuprofen correctly, but what about possible side effects? Like any medication, ibuprofen can have side effects. These can range from common, minor issues to rare, more serious complications. Common side effects include feelings of nausea, instances of vomiting, diarrhea, bouts of dizziness, or even a mild headache. While these are typically not cause for alarm, it's important to listen to your body and consult a healthcare professional if you're feeling unwell. On the other hand, ibuprofen can sometimes lead to more serious side effects. These may include stomach bleeding, kidney problems, or severe allergic reactions. If you experience any of these, seek immediate medical attention. Remember, ibuprofen can be a useful tool in managing pain and inflammation, but it's crucial to use it responsibly. So, now you know when and how to use ibuprofen and what to watch out for. It's a useful tool for pain relief, but comes with potential side effects. Remember to consult with your healthcare provider if you have any concerns or questions about using ibuprofen. Stay healthy and take care.
If you've made it this far, let us know in the comments why you're using this medicine.